So again, welcome to our course with Dr. Coomaralingam. So this course is heat exposure and heat-related illnesses in the workplace, and this is presented by the Selikoff Centers for Occupational Health. We're very excited to have you all here. So the first thing I would like to do is do the accreditation and the disclosure. So as you can see here on the right is the accreditation and disclosure statements from the Westchester Academy of Medicine. So yep, no commercial funding has been accepted for this activity. And again, please sign in the link in the chat. Certificates of attendance will be provided to everyone following the activity. And if you are taking this course for a CME credit, you will need to complete the evaluation credit or the evaluation link at the end, which we will send. And the link. All right, and for the agenda today, we're going to start with our welcome and the accreditation and disclosure statement, which we've just done. And then Dr. Coomaralingam is going to get started with an introduction to heat-related illnesses, discussing risk factors for heat-related illnesses and the prevention of heat-related illnesses, followed by a Q&A. All right, and about the Selikoff Centers for Occupational Health. So we are dedicated to providing cutting-edge clinical services with a focus on prevention to keep workers healthy and safe in their workplaces. Our multidisciplinary team includes physicians, nurse practitioners, industrial hygienists, ergonomists, social workers, workers' compensation and benefits specialists who provide comprehensive patient-centered services. So we diagnose, treat, and treat occupational diseases, evaluate the work conditions of our patients to determine whether other coworkers may be at risk, and suggest measures to improve work environments. We identify workplace hazards and those are used to prevent occupational diseases through training and education of workers and their employers, along with establishing effective workplace interventions. And with that, and we do have 4 locations, so I just want to point that out. So we have a location in Manhattan, Staten Island, Yonkers, and Suffern. And now with that, I would like to pass it on over to Dr. Coomaralingam to go ahead and get this course started.
All right. Thank you, Daniel. Hi. Good afternoon, everyone. Thanks for those who were able to attend today. And yeah, hopefully, this information is helpful for you regarding heat exposure. So yeah, we'll go ahead and get started. Next slide. Yeah, so just as a standard disclaimer, nothing to disclose here. Next slide. All right. So why is heat exposure important to begin with? So many people probably have noticed it is getting a lot warmer. Globally, the 10 hottest years on record have all occurred since 2005. And actually, with 2023, that was actually deemed to be the warmest year on record. That was done by the World Meteorologist Organization, also the National Oceanic and Atmospheric Administration, and the UN. Also, the European Union's Copernicus Climate Change Service actually did acknowledge that the global temperature for 2023 was 1.4 degrees Celsius warmer than pre-industrial levels. So just to put that in context with the Paris Climate Agreement, it had identified a threshold of 1.5 degrees Celsius above which humans and also ecosystems would struggle to adapt to the elevated temperatures that we may be experiencing. So in terms of heat-related illnesses, thousands of workers do experience these types of conditions. And unfortunately, the way weather trends and climate is progressing, this trend will likely continue. Right now, at a national level, there is no standard in place. However, as of October 2021, OSHA has proposed rulemaking regarding having a national standard in place. However, with this process, I looked a bit more into it with the U.S. Government Accountability Office. In terms of the rulemaking process, this can take upwards of years, if not decades, unfortunately. Some of the drawbacks with the process, unfortunately, it can get bogged down by a lack of resources, also strong industry opposition to the situation. Especially when it comes to climate change. Of course, it can be a very hot button topic, pun intended, and also the bureaucratic process in general. That can also lead to delays in terms of trying to get things established. Next slide. All right, so just as a general definition of heat stress, so this is basically when the body cannot get rid of the excess of heat that's being generated. It's the net load that's going to be on the worker that they are exposed to. And it can be a combination of both internal and external factors, internal being metabolic heat that's being generated by the individual, as well as external environmental factors. So two of the most common types of external are, of course, weather-related, but also man-made heat exposure. So, for example, in the manufacturing industry, being exposed to radiant heat from the equipment that's being utilized, depending on the occupation. And overall, also the clothing that is worn, PPE is required, personal protective equipment, that can also add layers and generate heat as well too, that the worker would be subjected to. Overall, this can result, of course, in an increase in heat stored by the body. Under normal circumstances, the human body is able to regulate temperature through natural cooling. Most commonly, of course, we do start sweating, perspiring. So when the sweat does evaporate, that helps cool the body down, bring down the core body temperature that way. Convection basically refers to air movement or a breeze that can also help dissipate some of the heat that's being generated by the body. And in terms of radiation, basically direct transfer of heat from the level of the skin, that can also take place as well too. When the body is exposed to more heat than it can handle, then of course the core temperature does rise and one's heart rate also does increase as well too. Next slide. All right, so thought it would be good just to go over some general metrics that people may have heard of. So of course, there's the ambient temperature, basically the environmental temperature that is measured, and this can be actually measured alone. There's also the heat index. This was developed by the National Weather Service, which combines not only the temperature, but also the relative humidity, which is the atmospheric moisture content. So on the right side of the slide, you will see a chart basically showing from left to right, going from the more cautious area to, of course, extreme danger from a heat index perspective. You have temperature on the x-axis, relative humidity on the y-axis there. And then also there is the wet bulb globe temperature. And this was actually a metric developed by the US military in the 1950s to help prevent heat-related illnesses in soldiers. Not only does it account for temperature and humidity, but it also does factor into account air current and also radiant heat sources as well too. Next slide. So just a little bit more about the heat index. So as a general definition, it's kind of the apparent temperature that one is experiencing, depending on the air temperature as well as the relative humidity. It's those combined effects. So typically, once the body does get too hot, of course, sweating is going to happen. The body starts perspiring. That sweat is going to evaporate, and the body is able to cool itself down that way. So it lowers the core temperature. However, when the sweat is not able to evaporate, the body is not able to adequately regulate its temperature. So, for example, in humid conditions, it's very difficult for that sweat that's being generated to evaporate. So one may feel much warmer in those conditions. The opposite is true as well. When the relative humidity is low, the rate of perspiring is able to increase and the evaporative process can occur. So that sweat is evaporating. So the body will actually feel much cooler in those types of environments. So arid conditions, dry conditions with little rain, you're able to sweat more comfortably, and that sweat is able to evaporate to cool the body. So basically, this kind of shows the direct relationship between air temperature, relative humidity, as well as the heat index. And that is to say, as the air temperature and relative humidity increases, the heat index is going to increase as well too. And conversely, when the air temperature and relative humidity decreases, the heat index is also going to decrease. Hope that makes sense to everyone. Next slide. All right, so in terms of heat-related illnesses, I'm more so going to focus on the first 5 that I've listed at the top of the slide here, but I thought it would be useful just to discuss some other heat-related phenomena as well too. So of course, dehydration. This is basically a loss of excessive body fluid from sweating from the body without adequate replacements, of course. Rhabdomyolysis, this occurs with heat stress in combination with prolonged physical exertion. So that will cause the rapid breakdown, rupture, and death of musculoskeletal muscle. So the breakdown of the muscle tissue, this will release electrolytes and also proteins into the bloodstream, which can cause eventually irregular heart rhythms, seizures, and even damage to the kidneys themselves. The common triad that you'll notice with rhabdomyolysis, and this is board relevant as well too, you'll see myalgias, so muscle pain, of course, weakness, and also very dark tea-colored urine, and that's due to the myoglobin, which is being released from the striated muscle. So that's what results in the color there. In terms of acute kidney injury, AKI, this can be due to renal hypovolemia, just due to dehydration, of course. Not enough fluid is reaching the kidneys to provide adequate filtration. Also, acute tubular injury to the kidney itself can occur, for example, due to rhabdomyolysis, since that will be releasing a lot of protein into the bloodstream, which cannot be filtered adequately, of course, through the nephrons, the kidney filtration units. And also heat-related tubulointerstitial nephritis. That can also be a common cause of AKI in these situations. Now, in terms of chronic kidney disease, and some people might have heard of these terms, or you may not have, there's what's called CKDU, which is chronic kidney disease of unknown etiology, or CKD-NT, non-traditional origin. And this type of chronic kidney disease was actually first described in El Salvador and also Costa Rican sugarcane agricultural workers. So it was noticed that this type of kidney failure syndrome was developing these types of workers. Researchers had noticed that as compared to commercial farming, it wasn't noticed this form of chronic kidney disease in subsistence farmers. So basically farmers who were just farming for their family, for non-commercial purposes, not creating a surplus. It was just for their own benefit, not for trade. So one possibility for a mechanism, in addition to thinking about pesticide exposure, infections, was whether or not exposure to occupational heat stress could be causing this form of chronic kidney disease. So researchers did try an intervention where they implemented a program of water, rest, and shade. And they actually noted that the chronic kidney disease was improving in these agricultural workers as a result of those interventions. So that's what led to them actually believing that the primary driver of the occurrence of CKDU and CKNT, which they called, to be in this type of workforce due to the heat exposure that they were experiencing. Interesting to note, traditional clinical markers for kidney disease, such as elevated serum creatinine levels, protein excretion, urinary albumin to creatinine ratio, they may not develop in these conditions until it's at a very advanced stage. So unfortunately, currently, there really is no widely accepted reference standards for what biomarkers might be present to allow for early detection in the case of CKDU and CKNT. But perhaps with more research, additional biomarkers could be determined in the future, of course. And then lastly, of course, hyperthermia, basically a much elevated core body temperature, which of course can lead to serious consequences from a heat-related illness perspective. Next slide. Okay, so yeah, just to start off, I'm going to talk about heat rashes and also heat cramps as well too. On kind of a spectrum of heat-related illnesses, you can kind of consider both of these to be in the quote-unquote milder form of heat-related illness. With heat rashes, this is due to skin irritation due to excessive sweating during hot and humid conditions, of course. Basically, the ducts in the deeper layers of the skin become obstructed, and this can lead to the development of pimples or blisters in clusters on the skin. So in the photos in the right, two types of heat rashes, also known as miliaria, are shown here. I got these pictures from the Mayo Clinic. In picture A, you can see what's called miliaria rubra, which is basically a cluster of small inflamed blister-like vesicles that you will see on the skin surface. They will be red in color. You may also experience intense itching with that form of miliaria. In picture B is what's called miliaria crystallina, another type of heat rash, which appears as clear and fluid-filled bumps. And with that particular form, you might not actually experience any itching, and the rash itself doesn't hurt as much. So, from a treatment standpoint, with these types of rashes, you want to keep the skin dry, of course. Powder can be used for comfort purposes, but it's best to try and avoid creams or ointments, since that can actually keep the skin moist and warmer. And of course, you want to keep the skin as cool as possible to help the rash resolve on its own. In terms of heat cramps, of course, this is occurring with excessive sweating during strenuous activity, because not only is the body going to be losing water, it's also going to be losing salts as well too. Low salts in the muscle tissue, this can result in painful cramps and also spasming. And this can also be a symptom seen in heat exhaustion, which we'll talk about later on. In terms of treating heat cramps, basically what's typically done is, of course, you want the person to drink water, take a break from what they're doing, drink water, have a snack. Salt tablets, interestingly, are not usually used. And part of the reason for that is with salt tablets, they can actually be absorbed slowly and can actually cause some irritation in the stomach lining as well, too. There is also the thought that by ingesting salt tablets, it could potentially create a hypertonic environment in the gut lumen, and that could potentially actually pull fluids away from the surrounding tissues, and that may actually further exacerbate dehydration and potentially worsen the condition. So that's another reason why salt tablets in particular not usually recommended when treating heat cramps. Next slide. Okay, heat syncope. So basically a fainting episode or dizziness episode that can occur with a decent amount of heat exposure, of course, can be triggered by prolonged standing in a hot environment, or a sudden change in position as well, too. Can also be a triggering factor for this type of episode. With heat syncope, if you're, again, thinking of heat-related illnesses in terms of a spectrum, down below, I have a figure here with heat rashes and heat cramps, more the quote-unquote milder forms of heat-related illness. Heat exhaustion, heat stroke, which we'll talk about later, being a more severe form of heat-related illness. Heat syncope falls right in the middle, basically, hence the black arrow that I've drawn depicted right there in that figure. Factors that can also contribute to heat syncope, of course, dehydration and a lack of acclimatization, which we'll talk about later on. So if you're not familiar with the term, we'll be discussing that in the future slides. Next slide. All right. So heat exhaustion and heat stroke. These are the two major, most severe forms of heat-related illness that could be experienced. With heat exhaustion, of course, it's the body's response to excessive losses of both water and salts. The symptoms can sometimes be non-specific. However, I've underlined and also starred this as well too. The distinguishing characteristics of heat stroke as compared to heat exhaustion is that heat exhaustion, it will lack central nervous system abnormalities and also extreme hyperthermia. Those are two defining characteristics for heat stroke, which is the most serious heat-related illness that one can experience. At this point, if one does reach heat stroke, it reaches that level, the body is no longer able to regulate its temperature on its own. The sweating mechanism has basically failed. Core temperature is rising very rapidly, and the body in general is not able to cool itself down. In terms of an exact number, core temperature can rise to as high as 100 degrees Fahrenheit or higher within a span of 10 to 15 minutes. When I was checking with the Cleveland Clinic, that cutoff point can vary. Cleveland Clinic actually mentioned it's at a temperature of 104 and above. So there is some slight variation there, of course. But again, this is a very severe high temperature. At this point, the body is not able to cool itself, and permanent disability or death can be a consequence if the person does not receive emergency treatment. Next slide. All right, so just as a figure depiction, you have heat exhaustion on the left, heat stroke on the right, some of the symptoms that you may see. On the right side with heat stroke, again, two of the defining characteristics, CNS abnormalities. So a person might have severe headache, confusion. They could potentially even lose consciousness too. And also very high body temperature, hyperthermia. And again, no sweating versus excessive sweating that could be seen in heat exhaustion. At this point, like I said previously, immediate attention is needed. The worker or the person who is experiencing either heat exhaustion or heat stroke, they need to be removed from the hot area. They have to be taken to a shaded or cool area, given fluids. Any unnecessary equipment, such as PPE that they're wearing, needs to be removed because, again, that is generating an insulating layer that's keeping heat in, and you want to try and cool them down. If cold compresses are available or trying to help circulate the air around the individual, that can also help in the meantime until medical help arrives on site. And most importantly, until medical help arrives, until EMS gets there, someone needs to stay with these individuals because, like I said, they could potentially lose consciousness. And especially with heat stroke, it is a very severe condition. So next slide. So risk factors for heat-related illnesses, of course, occupation can be a big factor. Not only with outdoor work, but also with indoor work as well, too. So, for example, bakery workers, boiler room workers, factory workers such as welders, just given the type of equipment that they're dealing with, that can also generate a lot of radiant heat that they're exposed to. Of course, outdoor workers, firefighters, construction workers, migrant workers especially can be a very vulnerable population as well. Many of them do work in the area of being laborers, construction workers as well too. A recent example of that, for those of you who may have been aware, the World Cup 2022 that was in Qatar, many migrant workers were used as a part of the workforce to help construct the stadiums where the soccer players were going to be playing in because they didn't have the adequate sports complexes at the time. It's something that they had to create from scratch in preparation for World Cup 2022. Unfortunately, many migrant workers did die as a result of the poor work conditions, which did include combating the extreme heat amongst other issues as well, too, unfortunately. The athletes as well, too, there were also many questions from some of the teams participating given the fact that the soccer players or football players, so, choose your term there, given the fact that they are going to be playing in this very hot environment, Qatar is not known for cool weather by any means. There were concerns about whether or not they would be able to perform in a safe manner when playing these games during that World Cup. Other risk factors, of course, age greater than 65 years of age. Above that age, it's thought that impaired thermoregulatory mechanisms, it does tend to dip a bit after that age as a part of the aging process, of course. Obesity, being overweight, is also considered to be a risk factor. The exact mechanism isn't actually known, but it is thought that it could increase heat retention, just given the fact that adipose tissue can act as a kind of a natural insulating layer, as well as also the increased thermal load for these individuals with any sort of physical activity. That can also be heat generating for those people as well too. Heart disease, of course, can also be a risk factor, just given the increased cardiac strain those individuals might experience as a result of working in a hot environment with their heat exposure. Pregnancy is considered a increased metabolic heat load state, so that's going to increase a lot of internal generation, another risk factor there. In terms of medications, blood pressure medications, as well as antipsychotics, TCAs, those can also impair thermoregulatory mechanisms as well too. And in terms of illicit drugs, amphetamines, cocaine can also increase endogenous heat production, as well as alcohol intake as well too. That can also increase heat production by the body too. Next slide. All right. So in terms of types of prevention, some people may be aware of this. There are kind of 3 levels of prevention: primary, secondary, and tertiary. With primary prevention, basically you're trying to prevent the condition before it even occurs, of course. That would be most ideal. Secondary prevention focuses on the condition has already transpired, it's already occurred, but how can we reduce the impact of that condition moving forward? And then tertiary prevention is with any sort of ongoing long-term effects from that condition. How can that impact be lessened or softened for these individuals? So most of what I'm going to talk about on the next several slides basically falls into the primary prevention category. Next slide. Okay, so in terms of controlling heat stress, kind of the 2 big categories of methods that you have to deal with that are, of course, engineering controls and administrative controls. Engineering controls basically refers to actually changing the physical environment, the physical layout of the work site to help reduce heat exposure. So, for example, improving ventilation and airflow on site so workers can have a cool environment to carry out their job requirements. Using reflective barriers or shielding to kind of prevent heat exposure that way. Administrative controls refers more to modifications in how work is being done, so more of scheduling methods or tasks. And I've listed some examples here at the bottom. So, for example, scheduling work during cooler hours, job rotation. So if hot work is required, being in a hot environment, trying to minimize a worker from doing that the entire day. If there's something else that they can do as a part of their schedule, maybe mixing it up so that it's not prolonged exposure. It's like intervals to kind of lessen the impact that way. And also not scheduling overtime hours during, the hotter weather seasons, especially when it comes to outdoor work. That can be an example of an administrative control as well, too. One thing you might notice is that I have listed a lot more administrative controls as compared to engineering controls. Generally speaking, from a public health standpoint, that does tend to be the case just because it's much easier to modify one's schedule than the actual physical layout of the workplace. Sometimes that's not achievable, unfortunately. In some cases, it is. It really depends on the work site specifically, but more oftentimes, administrative controls are more feasible. Next slide. All right. Of course, training is very important, not only once work starts, but even beforehand, especially with outdoor work. Before that's even going to begin, you want to make sure workers understand what to expect when they officially start working. And having a heat stress training program can be very useful, just to educate workers about the signs and symptoms of heat-related illness, what to look out for, what steps to take when minimizing the risk there, in terms of first aid, what to consider to do if you start noticing symptoms, use of proper equipment, PPE, personal protective equipment, if that's available, how to access it, how to use it properly, of course. And also the idea of acclimatization, very important concept, which I know I mentioned earlier. So in case you're not familiar with that term, we're going to talk about that on the next slide. Next slide. Yep, thank you. So yeah, so in terms of climatization, basically it's trying to physiologically adapt the body in a gradual manner. So it builds up endurance to these hot environments. Generally speaking, this can take place over a time period of 7 to 14 days. It could be longer. Everyone is different in terms of how they adjust to the situation. So in terms of new workers, there is a rule that's called like the rule of 20% for building tolerance to heat. And basically what that involves is for day one, no more than 20% of the usual duration of work should take place. And then no more than a 20% increase in that work duration for each additional day. Now, if you're considering workers who have prior experience, you don't need to be that restrictive. They might already have some adjustment there in terms of what to expect. Their body might already be physically conditioned to the environment. So, for example, no more than maybe 50% of the usual duration on day one, maybe no more than 60% on day two, 80% on day three, etc. There is no like 50, 60, 80% rule. This is just an example that I gave for workers with prior experience, but it's just to indicate that with previous experience, you can be a bit more generous in terms of how you're able to condition those workers again to the hot environment. Next slide. Right. So yeah, so some key points to keep in mind. Like I said, with new workers, you have to be especially careful because it's their first time. That first 14 days, definitely want to closely observe them or until they're fully acclimatized. So it could go beyond the first 14 days. Again, everyone is different in terms of how they adjust. Workers who are not as physically fit, they may need more time, and it's okay. That is okay. You just want to make sure that these people are safe when working in the heat and being exposed to these factors. It's good to note that with acclimatization, a few days of non-heat exposure is okay. That's not going to affect things. You don't have to reset the process. In case a few days go by. And also taking breaks in air conditioning, that's not going to impact this adjustment process from a physiological standpoint. Next slide. Okay, of course, hydration, definitely very important. Speaking of hydration, I'm just going to take a quick sip of water, sorry. All right, thank you. Sorry about that. So, of course, when it comes to water, definitely want to have it accessible. It has to be readily available in the work area. Ideally, having someone on site who's going to check on water supplies, determining how water is going to get to where it's needed to go, just to make sure everyone has that available. And for workers, this might sound silly, but providing individual drinking cups or drinking containers is ideal. You don't want people to be sharing water bottles just because they may take a few sips here and there, and think they're good for the rest of the day. But no, you want to encourage workers to hydrate themselves. Definitely keep track of how they're hydrating them. If sweating is going to occur for several hours, depending on the type of work that's being done. Considering sports drinks like Gatorade, for example, which have electrolytes in them, can also be useful too to help with salt replacement as well. And just as a brief aside, that's actually where actually how Gatorade was developed. It was actually created back in 1965 at the University of Florida College of Medicine. The researchers there were actually looking at an inquiry from the Florida Gators football head coach at the time, who was interested in trying to help their athletes who, of course, practicing in the hot weather in Florida. They are losing a lot of bodily fluids from sweating. Basically, how to prevent them from losing those fluids, like something that would act as a replacement during physical exertion. So that's how Gatorade came to be. So Gatorade, if you were wondering where the name came from, that's basically how it came about. And lastly, also definitely want to avoid alcoholic beverages, of course, because that can also be further dehydrating and also does produce endogenous heat, of course. And any drinks with high caffeine intake as well, too. Caffeine is considered a diuretic, so that could even be further dehydrating as well. Next slide. Rest breaks. Okay, so very important, of course. Definitely want employers should be promoting this, having workers take breaks to hydrate, get some rest, especially for new and unacclimatized workers as well too. Sometimes they might have to be assigned temporarily, at least, lighter workloads, and also giving them more frequent rest periods as well too. But in general, and this is across the board for experienced workers as well as new workers as well too, work periods and rest periods may need to be shortened and increased depending on the temperature and humidity for that day, also the amount of sunshine, radiant heat that's happening, if there's no air movement at all, also depending on the protective equipment that's being used, PPE, and also for more physically laborious tasks. Shortening the work periods and increasing the rest periods may be warranted as well too. Next slide. Okay, so in terms of limiting the heat burden, so when it comes to PPE, of course, depending on the type of PPE, developing the work and rest cycles, it could depend on the type of PPE that's being used and how long that individual has to wear it for. That can also be an additional factor. The worker's individual state, not all workers are going to be the same. They're going to have different fitness levels, work at different rates, their hydration level and acclimatization level. That can also be a factor too in how well to limit heat burden. That also needs to be taken into account, and also environmental conditions as well too. So, like I mentioned, the level of heat and humidity in the area. If outdoors, what's the wind speed? If there's going to be a lot of sunshine, no cloud cover, that can expose people to an increased heat source as well too. And also if working indoors, if there's no AC or if there are fans available, that can also be a factor to consider as well. Next slide. In terms of wearable PPE that can actually help with heat burden and heat exposure, there are quite a few. They do vary in terms of simplicity, such as ice vests, for example. It's a very cheap option. However, because the ice vests are going to melt, of course, you can't really control how long they're going to last for. But there are a very cheap option. Cost can vary with these methods and also their maintenance and wet maintenance as well too. For example, there are water-cooled garments, which basically involves wearing a vest where water is circulated through the vest to kind of help with cooling. But that kind of system, it does require the worker to be tethered to a machine that's actually going to circulate that water through the garment that's being worn. So it's going to limit the person's range of motion, their ability to carry out work. So from a practical experience, that can be tough as well. Sometimes if the cooling system is too cold, that can actually reduce the amount of heat transfer that's occurring from the body to the environment. Because if it is too cold, the body naturally wants to hold on to heat. Especially at the core, it wants to keep the core as warm as possible. So you want the cooling system to be cool, of course, but not too cold, because otherwise it's not going to be an efficient transfer of heat from the body to the environment. So yeah, oftentimes with these types of wearable PPE, it might not be ideal during actual work time. However, when the patient, or I should say, when the worker isn't actively engaged in work, that might be a good time to use these forms. So core body temperature, when you're taking a break, it's going to decrease very slowly. It's not going to be instantaneous. So these wearables could be used during that time to help lower the core body temperature. And by helping improve the amount of heat removal from the body, of course, it's going to reduce the risk for heat-related illness and help the worker kind of get back to work as soon as possible, of course. So there are active methods in terms of cooling. So for example, with the cold packs, it could be even cool wet towels. And of course, the wearable devices, like I mentioned, a few examples there. Or it could just be more passive. For example, physical rest, just moving to a cool environment, whether or not that's a shaded area or an air-conditioned area. Either way, at least it's something. It's going to provide some benefit that way. Next slide. All right, so on this slide and also the upcoming slide, I just wanted to share some information from our American Occupational Health Conference that we had last year in Philadelphia. There were a couple of presentations that I thought were pretty interesting regarding heat exposure. So there was one presentation on a biosensor wearable, and this was presented by Dr. Scott Levy and Michael Wasik from Chevron. It was regarding a biosensor that they've had in development since 2020. Initially, it just started out as a patch to help detect water and electrolytes from the worker itself. But now it's much more advanced over time. It's also basically a patch along with an app, which has transmissible statistics, so measuring sweat, fluid loss, and dehydration in real time. It's still in development, of course. When they had given this presentation last year, they were thinking of this year, 2024, for an actual product. The patch itself is about the size of a Band-Aid. It actually goes on the medial aspect of your bicep. And then it has a chip that's basically transferring and recording information. Or I should say it's more so transmitting information to an app on your mobile device. And during the study, they were interviewing subjects, conducting surveys, and of course, reviewing the patch information. What they found was that, of course, the skin does not account for the full dehydration risk. There is also variation depending on the individual worker, the type of work that they're engaged in, and also the type of work environment that they're in. For example, the type of personal protective equipment that they're also using too. One thing the speakers mentioned was that trust can be an issue, of course, because there is the suspicion of, okay, it is recording information, but how much information is it recording? The worker may question, am I being tracked? Having this patch on me, having the mobile app too, what information is it collecting from my mobile phone? That can also be an issue that they did encounter conducting this study. And during the question and answer period at that point, someone also did bring up the point that there does seem to be a reliance on the smartphone itself. So depending on the work environment, it's not possible to have your phone with you. So for example, in decontamination areas, it can be very difficult to have a smartphone device with you. So one of the speakers did mention that Android is looking into that, making their devices a bit more work friendly, environment friendly. So that might possibly be an issue that they are addressing. At least at the time of this presentation, last year in June, Apple had not been yet addressing that specific issue. So we'll basically see what the future holds. Next slide. Okay, and the other presentation I just wanted to share as well too, this was a presentation on a heat stress surveillance program that was rolled out at the University of Texas. This was presented by Dr. Rhonda McCarthy of Concentra and Dr. William Perkison at the University of Texas School of Public Health. So using information from the Journal of Occupational and Environmental Medicine, some guidelines from them, they developed this surveillance program to basically help analyze trends, identify problematic areas, and provide constructive feedback to employees as well as also employers. So they met with employers and also stakeholders regarding, this type of surveillance program that they wanted to roll out. It involved medical evaluations, not only at baseline, but also when returning to work and also at regular intervals as well. Based on the screening questionnaire form, if there were any reported risk factors, further evaluations were conducted. Also, if the person was having another job or if they were working overtime, they also collected that information as well too. What they were specifically doing as a part of those other jobs and what hours they were working too, because that can also affect the heat exposure risk. And with their study, they did notice that at least 2 or more risk factors were more likely, that individual was more likely to have a heat-related illness. And overall, with the data that they did collect, they noticed that the program did help decrease median costs, I should say, by about 50% as compared to 2 years prior to when the Texas program was rolled out. And they also did notice there was a decrease in heat-related illnesses as well too, which is great. During the question and answer section of their presentation, one person from the audience did ask, how is the program doing currently? And there was a bit of a pause. And unfortunately, they did mention that the program actually was no longer in effect. It actually had been shut down. And mainly that was also because of the fact, like I had mentioned initially, OSHA does not really have a national standard in place. Therefore, I think it was Dr. Perkison had mentioned that with trying to roll out this type of surveillance program in the workplace, you really have to, have the employer convinced or kind of buy into the idea that the additional costs are worth it. Like having this type of program in place is one, of course, keeping workers healthy, which should be an objective, but also keeping them healthy in the long run. Decreasing the amount of heat-related illnesses that are taking place, and also the potential costs with addressing those heat-related illnesses. So promoting safety in the long run with having this type of surveillance program, it's definitely worth it in the end. So that's something, again, is like another conversation to have with them. So next slide. All right, so just as a brief summary, looking at the time as well too, definitely want to give some time for Q&A, of course. So of course we've seen, climate change is becoming more of a prominent issue, and definitely preventing heat stress is a major issue that we should try and, shoot for, of course, especially not only from a productivity standpoint, but just in a general healthcare standpoint as well. Employers should be providing adequate training to their workers just so they're educated about what heat stress means, what it can cause, like how it can impact their health, what safety measures to take if heat related illnesses do occur, and also how it can be prevented. And that's why I think having a national standard to help kind of enforce and kind of promote these guidelines would be very beneficial. Right now, at a state level, there's only 3 states that actually have a workplace heat standard in effect right now. It's California, Minnesota, and also Washington. I actually gave this presentation as a part of NICOSH, the New York City Occupational Safety and Hazard organization, as a part of uh, a heat stress panel that they had in June of last year. And they did have a speaker who talked about, from a legislative standpoint, what the state was currently doing. So there has been a proposal that was submitted to the New York State office in terms of trying to get a heat standard in place for New York itself, which is great. That proposal has been submitted. How long it's going to take, like I said, it could take years, perhaps even decades, but we'll see. With a lot of pushback that is occurring as a result of climate change, that could change things, but we're just going to have to wait and see how things kind of pan out from that perspective. All right, next slide. So just in terms of references, on this slide, on the next slide, I just referenced some of my sources. Some good websites here with information for you guys as well too. Heat.gov, great resource for general information about heat exposure and also information for individuals in the workplace. They do have a lot of like printable information as well too. Same with the CDC as well too, cdc.gov. A lot of great information, not only from a health perspective, but also the workplace as well. And from a medical perspective, Cleveland Clinic, Mayo Clinic, great information there as well too. The migrantclinician.org website, also a lot of helpful information there, not only with regards to heat exposure, but also health issues that migrant workers in general are experiencing. And then also weather.gov, excellent resource just for basic information about weather, in general, basic definitions to help get people more educated about heat and weather in general. Okay. And with that, next slide. Any questions or comments at this point? Sorry for taking up quite some time with this presentation. When I gave it previously, we ran close to the hour mark as well too. So.
No, I want to thank you, Dr. Coomaralingam, so much for that incredible presentation. We do have one question in the chat. We have a couple now. So could one use the time taken to respond to treatment as a differentiator between heat exhaustion and heat stroke? That is, an individual with heat exhaustion responds quickly to removal from exposure.
Great. So yeah, that's a great question. At least from what I've read, it is difficult just given the fact that with heat exhaustion and heat stress, they are both considered to be extreme forms of heat-related illness. Of course, with heat exhaustion, ideally, once that is recognized, getting help as soon as possible can help with preventing, the possibility of it progressing to heat stroke, of course. In terms of an exact timeline, at least from, what I've been able to review, I haven't seen there being like a general time frame in which that may occur. But that's a great question, though.
Mhm. A couple more here, but before I go through these questions, I would like to let everyone know there is an evaluation form in the chat. Even if you are not wanting a CME credit for this, we still ask that you complete that evaluation form. So if everyone on the call could please just go ahead and do that if they have some time today, that would be really beneficial to us. But with that, I'm going to go ahead and go to this next question. So what are some ways that workers can document unsafe temperature conditions at work? We've tried little thermometers that measure humidity, but they are not reliable. Are there things workers could take pictures of that can document hot conditions outside of them in their sweaty uniforms?
Right. So yeah, great question there. And I think part of the difficulty with this as well too is at least at a state level, like I mentioned, in terms of having a workplace heat standard, it's only the like three states currently. We'll see what New York does, of course. But yeah, it's basically California, Washington, and Minnesota. In terms of what individual workers can do, at least right now, just kind of definitely, of course, reporting the matter to their direct supervisor and manager, at least so an incident report can be filed, so at least some form of tracking of these events is occurring. If they can take their own temperature, while working, that would be great as well too. In some cases, if it is a hot environment, ideally, that temperature in the environment itself should be recorded. Again, because there isn't a heat standard in place, the employer itself might not be recording the ambient temperature, kind of the temperature in that environment. But just reporting it to the employer, at least, just so it's being documented, because of course, the more times it's being reported, the more it would indicate that this is an ongoing issue, and hopefully kind of spur the employer to realize that, yeah, this needs further investigation, since more and more workers seem to be reporting the issue.
Yeah, thank you. Two more questions here quickly. Are patients on certain medications more predisposed to HRI?
Yeah, so certain medications, like I mentioned, kind of just general categories, antipsychotics like SSRIs, because they can also interfere with the thermoregulatory mechanisms of the body, just as a part of natural cooling, and also anti blood pressure medications as well too, antihypertensives. Just from a standpoint of dehydration risk, sometimes with the blood pressure medications, if the person does, let's say, for example, accidentally doubles up on their medication, or they're on a higher dose, which keeps their blood pressure very low. If they are working in a hotter environment, with the heat, of course, they may be losing more bodily fluids, especially if they're not hydrating, if they're not drinking plenty of water, of course. That could also be a potential risk as well too. So kind of those general categories of medications. Like I also mentioned as well too, just in terms of drugs, like illicit drugs, amphetamines, cocaine, that can also increase endogenous heat production, as well as alcohol intake as well too. Sometimes, at the end of a long day, especially working outdoors, many workers might be like, oh yeah, you know what? We put in a good day's work, let's go, grab a drink somewhere. You might go to happy hour, for example, have a few drinks without realizing that, you really should be hydrating yourself, especially post work, and then going back to work the following day and potentially dehydrating yourself even further. So just thought I'd mention that as well.
Yeah, thank you, Dr. Coomaralingam. And final reminder to everyone, please fill out the evaluation that is in the chat if you have some time today. And then the final question is pretty simple. Are we able to share these slides with the group?
Sure. So yeah, I actually did get this request when I had done this presentation previously. If people are interested in these slides, I would be happy to share them. The only two slides that I may have to just think about are just my own notes that I had taken for the two presentations from AOHC last year. And again, those individuals, Dr. McCarthy, Dr. Perkison, Scott Levy, and Michael Wasek, they were very approachable about the situation in terms of the information being shared. But yeah, with regards to those two slides, I might just have to think about those. But the rest of the presentation, if people are interested, yeah, we could make those accessible. I think that would be okay with me at least. So.
Yeah, absolutely. So I'll connect with you on getting those slides, but for anyone that actually needs the slides or would like to review them, please email me. My email is in the chat, and I will work with Dr. Coomaralingam to get those to you. And with that, I want to thank everyone for joining today. I hope this was very insightful for you. It was very insightful for me. And I want to thank Dr. Coomaralingam for hosting today. And yeah, thank you all for joining, and I hope you have a great rest of your day.
Thank you all for attending. Yeah, take care. Enjoy the rest of your day. And I know the weather is getting warmer, so definitely make sure you hydrate.
Absolutely. Yeah. Thanks so much, Dr. Coomaralingam.
You're welcome. Yeah, thank you again.